But you know that that's not all it does, right? It innervates the muscles of the medial compartment. Okay? So, when you're kicking the ball, maybe yesterday, a lot of you use the straight-on kick. That boiled down to the quadriceps, right? Some of you, like that gal, I forgot her name already, strawberry blonde. She probably was using the sidewinder a little bit, you know, because she was using the adductors. You probably don't want to. Oh, you're going to record it. Okay. All right. So it innervates those adductor muscles as well. Okay. So the obturator nerve is the nerve of the medial compartment. Slide number 2. This is something you should have fixated on a while back because I gave you a pretty strong clue about it. And hopefully you have this figured out so that the only thing you really worry about is putting L2 and L3 here.
Can't see.
Well, that's your fault. Why don't you sit over there?
He is too trill.
Oh, I'm just.
Or Jasmine. I just got Chantrice off of Chanel and Chanel on Jasmine. So you're doing the same thing with your anatomy, I'm sure.
That's right.
Yes, we are.
Yeah. That's natural human brain. So you start with L2 and L3 here, okay? And then you progress. L2, L3. Let's see if I can do this without cramps. L3, L4, okay? L2, L3, L3, L4, L4, L5. Just take L4, L5, put it back here. L4, L5. L5, S1. S1, S2. And that's that whole chart. The only one you worry about is this one right here, because then you deduce all the rest. You just go down and bring L4, L4, and L5 back up here, okay? So if you're testing the patellar ligament with the tap of it, right, with the little thing for the reflex, you should know which spinal cord segments, which 2 spinal cord segments you're checking.
L3, L4.
Yes. Okay, slide number 3. Slide number 3 has to do with this thing right here and this thing right there. This is something that we would like to have seen in the lab. I don't know if you got a chance to do it though, but it's lecture material also because you need to, well, there's old Brian.
My apologies.
That's okay. I had really important things to do, like getting lunch. Okay, so this is the anterior division of the obturator nerve, and the posterior division would be behind this muscle because we know the adductor brevis splits the 2. All right, that's slide number 3. Slide number 4. Yes, ma'am.
So, adductor brevis splits the superior, inferior.
Anterior and posterior.
Oh, anterior and posterior.
Yeah.
Obturator nerve, right?
Yes. The obturator nerve goes through the obturator canal, which is a groove in the hip bone. You want to see that? That could be a practical question. That groove could be painted green or black or red or blue. You know, it says what goes through here. Obturator nerve goes through there. Obturator artery goes through there. Obturator thing goes through there. Once they get through there, they get into the medial thigh because we know that's the nerve of the medial thigh, right? And then the next anatomical thing of importance is the fact that it gets split into 2 branches by the adductor brevis, anterior and posterior. Okay, that's more than you asked. I think you wanted just a simple answer, but that's the long answer. Okay, so slide number 4. This ligament, the iliofemoral ligament, is there to try to prevent hyperextension. And it's good because you can stand straight without using your muscles a lot. Okay? There are other resistors of hip extension. Okay? They would include the ischiofemoral ligament. that was a slide after this in the regular lecture. And you have those. The ischiofemoral ligament accomplishes the same thing, but the iliopsoas muscle is going to resist extension also because it comes right across here and goes right there, right? That's the lesser trochanter. That's the insertion of the iliopsoas. So the iliopsoas is going to prevent extension also. It's going to resist extension because it's a flexor of the hip. Also, the pectineus muscle does the same thing. The pectineus muscle comes down from here, across over to here, and it's going to be a flexor of the hip also, so it's going to resist extension. So, you got 4 good resistors of extension. Iliofemoral ligament, ischiofemoral ligament, iliopsoas muscle, pectineus muscle. Is the gluteus maximus going to resist extension?
No.
No.
Absolutely not. It's going to make extension. All right. Slide 5. This is naval. Standard thing that you have at least, at the very least, a vague recollection of. That stands for femoral nerve, femoral artery, femoral vein, empty space for lymphatics. What's important is that you realize which direction we're going when we do naval.
Lateral, medial.
And the idea is that we're starting lateral. Okay? That's what the L stands for. We're starting lateral and going medial. So the order from lateral to medial is femoral nerve, femoral artery, femoral vein, empty space for lymphatics. Okay? That's important to the cardiac catheterization people because when you got a catheter, you stick your catheter here to go up to the heart. Pretty astounding phenomenon, but it's true. That's where they start. It goes up through here, through the external iliac, through the common iliac, up to the aorta, hooks around the arch of the aorta, and goes into the heart, way up here, you know, off the slide someplace. That's how they do it. Pretty astounding that they can do it that way. But they want to be very careful to stay away from the nerve and from the vein, and they know the nerve is lateral and the vein is medial. Okay? This one is going to have a nice pulse. This won't. This will be actually separated by a special septum here, the sheath. Okay, so that'll help also. Right? But you do want to know the order of structures here and how they. Okay, where are we on? Slide number 6 now. Okay, slide number 6 has to do with those adductor medial compartment muscles again. Adductor longus. Cut adductor longus, you see brevis. Cut adductor longus, and you see magnus. But there's something about these adductors that's a little bit different, and that has to do with the innervation of all the fibers. That one's innervated by the same one that innervates that one, that innervates this part of this thing. But this part of this thing not only has a special place to go to on the femur, that's important for the lab, it's also innervated by another nerve. It's not innervated by the nerve that innervates all the adductors, it's innervated by the tibial nerve. So the adductor magnus is a medial compartment muscle that's innervated by 2 nerves. All right? Okay. Slide number 7. I think this is number 7.